Welcome to the President's Podcast with the Black Nurses Association of Greater St. Louis. I am your host, the President, Dr. Leonora Muhammad.
And I'm your co-host, Vice President Mia Glover.
Oh my gosh, and we are super excited because this is our first session episode of the President's Podcast with the Black Nurses Association of Greater St. Louis. And we got special guests today, our executive board of the BNA STL. So, oh my God, I'm so happy to see all of you guys here today. Thank you for joining us. Are you happy? Are you excited? This is big moves for the BNA. Absolutely. All right. So we are going to get to know each and every one of us that's on the call today. So we're going to go around, we're going to introduce ourselves. Tell us how long you have been a nurse and where you work at and how you were actually introduced to the BNA of Greater St. Louis. So we'll start off with our immediate past president, Miss Keita Stevens.
Good evening, everybody. My name is Keita Stevens. I am the immediate past president of the BNA of St. Louis. I have been a nurse for 15 years. Currently, I work as a case manager with United Healthcare Optum. I was introduced to the BNA STL through Kenya Haney, now Williams. She is my mentor. She came by one day and she said, "Hey, if I reestablish a nursing organization, would you come?" And I was like, "Okay, yeah, I absolutely would be there." And I came, and I have never left since. So I'm currently a lifetime member of the national organization, and I cannot be more excited about being a nurse as I am as being a part of the BNA of STL because it's in my blood.
Absolutely. And let's check out Miss Edith Cole. What brought you to the BNA?
Good afternoon. My name is Edith Cole. I am chairman of the Parliamentarian Historian Committee. I have been a nurse for over 40 some years. I'm semi-retired. I came involved with the Black Nurse Association from my instructor, Miss Higgins, at Forest Park Community College. And she saw something in me that I didn't see, but I attended one of the meetings and I just can't tell you how wonderful, how it has touched my heart and what it has done for me as a person and as a nurse. And I encourage each and every one to please come out and attend our meetings and get to know our members. Welcome.
Mm-hmm. All right. Thank you, Ms. Cole. And next we'll move on to Dawn Patrick, our treasurer.
Good evening, everybody. My name is Dawn Patrick. I am a family nurse practitioner. I have been a nurse for 17 years, and I became a part of the BNA after I was invited by Mia Glover, our current vice president. And like Miss Edith and Keita, I have never left ever since my first meeting. I am also a lifetime member, a proud lifetime member of the National Black Nurses Association as well. I am very excited to be on the call today and super excited about being a part of the BNA. And I hope you guys understand our enthusiasm and come join us so you can find out why we love it so much.
Yes, absolutely. Good. And the person that keeps us all together, Miss Michelle Randall, our chapter secretary.
Good afternoon, everyone. I am Michelle Randall. I am the secretary. Actually, I have been a nurse for over 30 years. I have been I'm retired from BJC Home Care, and I currently own my own business, a consumer directed service, and also starting a nonprofit. The reason I joined this wonderful organization is I actually attended a scholarship banquet a couple of years ago that was formed by our president and past president, Dr. Leonora and give me your doctor title, Keita Stevens. And they share the same passion of sisterhood, everything that I wanted to be involved in. and I'm also a lifetime member, and I am so happy I'm part of the organization.
Wonderful, wonderful. Yes. And we cannot forget about Madam VP, Miss Mia Glover. Tell us about what you do and how you got brought into the BNA.
Absolutely, absolutely. So I share the passion of these ladies, but I am Mia Glover. I'm a nurse practitioner. I'm also a lifetime member of NBNA, but I was brought to nursing and to BNA from Miss Edith, who I've known my entire life. She is definitely a advocate for nursing. And when you are in the space of greatness, you can't help but to be enthusiastic and feel like you can do anything. And so throughout my nursing career, I have really adapted that, and BNA has given me an opportunity to reach out to everybody that I meet and tell them and share my passion for nursing. And so that is my BNA story.
Yes, and as you can see, we are all passionate. And the first time I came to the BNA and I heard immediate past President Keita Stevens talking about going to conference, that is what really made me want to continue to come on to every single meeting, join the organization, see what it's about, because I felt that passion, that same passion that we see right here today on this call. I have been a nurse for 18 years, the newly elected president, so I'm still learning. So Keita's keeping me in line with everything we do, and all of the rest of the executive board is keeping me in line. I'm currently Associate Vice President of Patient Care Services for Horizon Health, which is a correctional healthcare company. And I just love being a part of the BNA. And as you can see, what we're going to talk about today, talk about the mission of what we do, why we're here, who we're serving in the community. That's what we really want to find out from our executive board today. So Keita, since you have been the past president for the last 4 years, thank you for your service. Let's start out there. So tell us a little bit about the BNA STL and really what's our mission and our goals so that people in the community will know what we do and what we do.
The Black Nurses Association is focused on our community and serving the health disparities that exist in our community. So what we do within our organization is always geared towards that. We participate in a lot of health events. We do a lot of mentoring, advocacy. We hold a annual scholarship banquet, well, luncheon. At this point, we've named it a luncheon, and it's now named after the wonderful Edith L. Cole. She is one of our historians, and she really knows a lot about the organization. So we decided, hey, this needs to be named after her. So that's one of the milestones that we've reached over the years. But we started at like 10 members at first. So during my presidency, we have built our chapter, and I think last year we had around 50 members, and we're still growing. And so I can't be more proud of what we've accomplished in these last 4 years. So, yes, our mission is always to serve our community and look toward the health disparities within the African American and minority population.
Great. That is absolutely wonderful to hear. And Ms. Edith, she said we named the BNA Scholarship Luncheon in your honor. So tell us about the Scholarship Luncheon and how it really supports our students.
Well, of course, I was very happy and was very, very much taken away, not just because of the title, because the need of it. As a student nurse, the any monies that they could get in through our scholarships helps them with paying for their books, their any classes they may have, and it may even assist them on other things that pertains to their education. We have given out, I guess, between $500 and $2,000 in scholarships. And that's a wonderful thing because that goes a long way with the students. And yes, each year, right about that time, I get excited. And again, we accept donations and we encourage those that would love to donate to the Black Nurse Association. Please do so. because let me tell you, when I graduated from nursing school, uh, I don't want to go too far into this here, but it was really expensive. The books were expensive, it took a lot of time. I was able to work part time. But that being said, if we can help a student along the way with paying for their books or their classes, that's exactly what we want to do, because there is a need for the Black nurses in the Black community.
Right. So that can our treasurer maybe shine a little light on, we know BNA is a non-for-profit organization. Can you talk a little bit about how the support of the community can help push our organization forward so we can do things like have these scholarship lunches and things like that?
Yes, we absolutely need and we love and welcome donations from our local members, our supporters. Sorry, y'all, this is home Zoom. I apologize, but I'm still excited about it. What I'm talking about, we need donations. So as Ms. Ida stated, we give out between, I think the lowest scholarship we've given out has been $750. The highest was $2,500. And we had some corporate sponsorships, and since COVID, monies have been tight lately. So we are still asking our corporate sponsors, we're asking local members, as we call them, friends of BNA. We have some very dedicated nurses who have decided to support our nurses as well. And we do get a few scholarship donations. But it takes a lot more to run our organization as well. We're very active in the community. We do toy drives, we do Christmas giveaways. We also try to have blood pressure screenings. We want to continue with holding annual health screens, which we were able to do a couple years ago before COVID. And just be a part of our community. We are all out here trying to educate. We talk about different health issues, especially hypertension and diabetes. And so we give out a lot of information. And the monies that we've been using so far have come out of pocket from our members. And everyone is a little stretched right now. So we just ask, $50, $25, $100, $1,000. That's the max that we've seen just from an individual donation. And we just would love to have the support of our community, because I think we, as you can see, we're very passionate. We do not let anything stop us from our goals, and we raise the money. But it would be really nice to have more than just 50 or 75 members support our local students. And that's really what we are passionate about. We have a mentorship program. And so we also try to not only just provide scholarships, but we also try to provide just book test taking skills and just different things in the community. We work very well with our local nursing schools. We have a partnership with lots, or all of them really. And so I don't want to list them individually, but we do have a partnership with the local student nursing schools. And so we're just asking for donations. We appreciate your support. Get on our website and see what we're doing. Reach out to us individually. We'll be happy to share with you what we're doing, and we're very transparent about where our monies are going, and we just ask for your support. So thank you so much.
Thank you. Thank you. So she mentioned our website. I'll give it to you throughout the presentation today or our podcast today, but it's www.BNA-STLOUIS.org. You can find us on our website, on Facebook, Instagram at BNA Greater St. Louis. And we do have our chapter meetings on fourth Saturday of the month, every month. And if you follow us on social media, you'll see what the Zoom link is and such. And I'll give you that information again later on.
Yes, absolutely. And as you can see, we are, like Dawn talked about, we are all over the streets in the St. Louis area doing many things, working with a lot of different partners and community organizations. So, Michelle, because you keep us all together, tell us about some of the activities and events that we have been doing over the last few months and years as we've worked in the community and working with our partners.
Yes, as Don has mentioned, we prior to COVID, we actually did health fairs, blood pressure screenings in the barbershops, trying to educate the men on blood pressures, any men's diseases that they were a little shy about talking about. So we met them where they normally go to, the barbershop. Also, we an annual toy drive. We do partner with different organizations, the food and diaper drives. We actually gave away shoes that we were given through the Reebok Soul for Souls. We gave those, donated those shoes to the homeless, and they were very appreciative. Um, and during COVID, what we actually did, we had to actually resume. We stopped for a minute, but when we resumed in person, we did a proper social distancing where we were outside. Um, Giving to the homeless, educating the homeless with masks and telling them how to do proper hand washing. We did food drives, also safe distancing. Um, we've been safe when doing this, and we've also still continue our annual Christmas toy drive, Adopt a Family. So we're still out there.
Yes, yes, absolutely. And then speaking of the help that we did during the COVID time, we actually received monies from our national organization, the MBNA, our national organization. We received money and donations from our national chapter to be able to provide the information and supplies and hand sanitizers and gloves and masks to those homeless populations. So our help comes not only from the community, but also from our national organization as well. So that is very important to us. And Kida, I wanted to ask you, because you have led the organization for the last 4 years, tell us why it was important for you to lead a group of passionate nurses like we are. Why did you want to take that leadership role and step into those shoes to lead us, to push us forward in the community?
It was given to me. I took it and ran with it, but my passion is to see people and our nurses move above and beyond what they can see in their daily living. Um, my passion is always to promote them to reach their highest heights as far as nursing is concerned. So putting them in the place of taking advantage of anything that they can as far as education, receiving scholarships for possibilities of obtaining different levels as far as their education is concerned. That's where I want them to, I want to put them in a place of where they may not have originally thought that they could go. I want to touch those gifts that lay inside of their hearts, that they felt like they weren't able to do. I want to give them the ability to do that. And if we partner with our national organization, there is always places, even outside of the St. Louis area, that they can take advantage of. So I am always looking to put them in the room. We always need a seat at a table. And so once you get that seat at the table, the sky is the limit. So that's the reason.
Wow, wonderful, wonderful, wonderful. And, even though our local chapter is the BNA of Greater St. Louis, we are a part of the National Black Nurses Association, and we have many, many chapters. I can't even keep up with the number that we have right now today. I think, it's over 100 chapters across the United States that we have, and we represent over 200,000 Black nurses across the country. So it just didn't start here in St. Louis. So Miss Edith, you are the historian, parliamentarian of our local chapter, but tell us a little bit how BNA started in the St. Louis area, because you've been a part of this chapter since the 70s. I heard Mia told me the other day that you have been a part of the chapter since the early 70s. So tell us how we actually got started and lead us up until now.
Well, thank you, and thank you for asking. The Black Nurse Association was originally started, well, they became organized in 1973. It took them 2 years to get up the membership and get the accreditation that they need in order to join the National Black Nurses Association. The local chapter was mainly made up of nurses from Homer G. Phillips Hospital, as you well know. Then they went to Veterans Hospital, VA Hospital, John Cochran on Grand. Then they went over to City Number 1, and then VA Visiting Nurse Association. Visiting Nurse Association was played a major part along with the Homer G. Phillips Hospital. And as you know, Homer G. Phillips Hospital now has an alumni, which we work partners with, and it's just so much history there. But there was definitely a disparity, a need for educating the Black community. And the nurses in the 70s, 73, 75, they knew that then. And guess what? There's still a need now. And that's why this organization is so important to me, because we're still filling that gap there, the need to educate the community as much as we can and as often as we can. Yes. So a lot of the organizations that have worked along with us, of course, has helped us to grow. But at the same time, we're still accomplishing the mission that we have set out to do. And that is so important. Yes, it is. Now, the chapter went from 75 up to 2007, and we became inactive. But in 2014, Kenya Haney, our president, she had the passion to reactivate the chapter. Because I worked with her at the hospital, y'all know that. She was a student there. And I used to tell her so much about the Black Nurse Association that she just, when she graduated from nursing school and left, she took away what I had told her about the organization. And that's how, see, that's what I'm talking about, planting that seed. Go ahead, tell her. Keita tell you about them seeds. Wow. That's why when Keita's give us a plant every year, it just touches my heart, because it's the seed that you plant that grows. Mm-hmm. Thank you.
That's wonderful. That's really awesome. And a lot of that we did know, but there's a lot of pieces of that you often add to us at the meetings, or when things come up and you add that information when we don't even know that we need it. Sometimes we don't know what we don't know. You're always passionate about making sure we're getting out voting and making sure that we are doing what we need to do, so that our voice is heard on a political level, because we are all affected by the laws that are made, and nurses have a voice. Our past national president, Dr. Eric Williams, used to say, whatever it is, a nurse can do it. And so we all share that as well. So I know you're deeply involved in the policies and the legislature, but tell us about the process that we do to get people to vote, and what our plans are as far as health policy.
Okay, every year in Jefferson City, there's a Nurse Advocacy Day, and not just nurses, but a lot of the health organizations throughout the state of Missouri, they come, and that's the opportunity that you get to talk with your individual state representative or legislator, and let them know what your concern is, your immediate concern about your community. As you know, we're always stressing the importance of teaching, uh, getting the proper information out to our clients and letting them know, well, this is the opportunity. You have a one-on-one opportunity to talk with that legislature and let them know. It's also an opportunity for you to recognize certain health bills that are up there. That's the time that you would go back to the organization and the members and tell them, listen, there's a certain bill that needs to be discussed. Do we want to support this bill? It just happened, a long-term care bill that we worked really hard on, and it passed. It was a bill that allows the family, get this, allows the family to put a camera in the residence room in the nursing homes. because of, as we know, the potential for abuse or neglect. That's a different topic. But the most important thing is, like with the COVID now, having that camera, I've already gotten some information back that the families have been so thankful for what we did. Having that camera now in the nursing homes, see it bringing tears to my cut. Having that camera in the nursing home for a lot of the families is what's helping them to make it, through the COVID, what we're going through the pandemic. So that really made my heart. See, this is what I'm saying about the nurse. See what I'm trying to tell y'all now, because we have been advocating for this camera to be placed in the rooms. We now have that privilege, not just us, but the families, to have that privilege of having a camera in there. So our voices are heard, and all you have to do is know who to go to and be prepared to attend that. It's a whole week, but it's only Nurse Advocacy Day that I really concern myself with. But I know that there are other health organizations that's involved in that. And it's held once a year. You get an opportunity to speak to the legislative body.
Yeah, and that's actually through the Missouri Nurses Association, right?
Yes, that was the Missouri Nurses Association. They were really, not this year, of course, last year. We had an opportunity that we were right next to them. Their table was there and we was next to them. I got an opportunity to speak to talk with some of the staff members there. Yes, and they were very excited too. And of course, they're introducing bills. Have what do they call them, lobbyists, people that go up there and keep pushing the guys to vote. Yeah, do this, do that. So that's what we're gonna get together on a few things and just being partners with the Missouri Nurses Association. Yes.
Absolutely. And that's what we're doing here on the local level. We also recently had the MBNA Day on Capitol Hill, which is usually held in February. I think it was February 4th this year. And we learn about the agenda items that we as a national organization are passionate about. And we also take those agenda items and we talk to our local legislators, like Ms. Edith just said, speaking with the Missouri Nurses Association, understanding what those bills are, and really our nurse practitioners. We have a lot of nurse practitioners in our organization, and really we trying to push for practice, independent practice in the state of Missouri. So it is really important for us to advocate on the local level, also understand what's happening on the national level so that we can positively make change in our community. So that is so awesome, Ms. Edith. We're so happy that you are passionate about that and keeping us up to date. And we also have a new health policy committee chair, Dr. Terry Murray. She also had been the previous president of the Missouri Nurses Association, if I'm not mistaken. So we are super excited about that too, because we got lots to learn and keep us up to date with what's going on in the community. So it is very important for our nurses to understand what's happening, but also for us to educate our nurses and make sure that they understand things that affect them. So Dawn, one thing that I know that is important to you is that our nurses that's part of our membership or really understand how to manage their finances and how to make financially sound decisions as they go into business. Because we had a lot of nursing entrepreneurs here, like Michelle Randall. She owns her own company and business. So nurses are not just doing traditional nursing anymore. We're venturing off. We're doing all kinds of things. We have businesses, home health agencies, staffing agencies, all kinds of things. So I know it's important to you, Dawn. Talk a little bit about why it's important for nurses to understand their finances and what we could really offer as a BNA organization.
Well, I think most importantly, we set an example in the community. As nurses, people look up to us for guidance. They look at us so not just for healthcare, but I think if we manage our finances, we tend to live healthier lives. And you know, when we're not financially stable, you know, we see food deserts in our community, you know, so the financial aspect of just nurses and just being a leader and example really shows us and helps us to, again, further and help the needs of our community as well. And so we really try to support those missions of the organizations that we work with, to provide financial education to us as well. Prior to COVID, we had Edward Jones representative come and talk with us. So we really try to incorporate other aspects of health and wealth as well. We have a partnership with a couple of Black-owned chiropractor companies when we're out in the community, who also, you know, show leadership, and they're business owners as well. And so, as you share, we have our members who are also business owners as well as nurses, and Michelle, as we spoke about. And so I think that when we can be financially sound, again, I think it just really empowers us to be more healthier. We can afford, you know, different types of foods, but, you know, finances. And we also, you know, show people as nurses how to, you know, find good, healthy foods at places like Aldi's and use their monies wisely to make better food choices. So I think financial advice and just being financially sound goes hand in hand with healthcare in general. So I think as nurses, we provide that support.
I'd like to add too, often we talk, Dawn, about making sure that nurses are getting the most out of their company that they're working for very early on. You know, we've met with HR of different companies, and they've come out and talked to our staff. You know, are you starting with the 401k right out the gate? You know, are you, you know, using everything that your company is offering you, you know, a collective financial planning. We've talked, had, like you said, Edward Jones guy came out, and that rep talked to the whole room, from people that were, you know, starting their first year or second year of working, to people that have been working for a while. And we assume that because people have been working at something for 20, 30 years, that they are set and they're ready to retire. But what we find is that not everyone has been dealt the same hands of cards throughout their life. And just because someone has, you know, been a nurse for 20 or 30 years doesn't mean that they are ready to retire financially. And so it's a judgment-free zone. How do we help you just get wherever you need to be? And, you know, how do we provide a safe space for you to be able to feel comfortable enough to say, I know I should have did this, but I had all this on my plate, and now I need help in X, Y, and Z. And then for us as other nurses to see, how not can we only not help our patients, but can we help our other nurses really thrive and be where they need to be?
And teach our students early on that it's possible to save, you know, even if it's $50 out of your check, which, you know, you may not see, to put towards your 401k or a savings account. We also provide, you know, just different financial advice overall, I think. And just, you know, as Mia mentioned, going to your employer and asking, you know, well, how much do I get for tuition reimbursement if you want to take a class, or will you pay for the organization, you know, for us to be a part of a great organization like BNA? And oftentimes we found that most companies do, especially if you work for a hospital system, that your conference fees can be covered, so that you can get more continuing education credits. And also, I think that that's just most importantly, just good sound advice that we provide each other, and a support system as well.
Yeah, I mean, there are people in our organization like me, one of 8 children, but the first college graduate of my siblings. And so I'm not the oldest child, but I was the first one to graduate. That being said, you got to think maybe that I don't have that generations of folks before me to say, hey, make sure you're doing this with HR, make sure you're doing this with HR. And so just having a professional home, a professional organization to come to, that you can kind of bounce things off of, have these kinds of conversations to make sure that we're getting all our whole package, you know.
Yeah, absolutely. And speaking of conference, because you brought it up, Dawn, This year is the 50th anniversary of the MBNA. And so at our conference, which will be held in Dallas, Texas, hopefully if everybody get their vaccine, I hope everybody been getting their vaccine so we can meet in conference because this is the 50th anniversary. So Michelle, tell us a little bit about what's going to be going down this year for the MBNA conference.
Well, we're looking forward to our conference this year. Unfortunately, last year, because of COVID, our conference was canceled. And that was the first one that was canceled in ever. We're actually thrilled to be going this year. And hopefully, again, if everyone's vaccinated, we're going to stay safe because we're a group of nursing professionals that they're looking for us for these things. Each year, this is an annual event. Nurses are coming from all over, all the chapters. Again, we don't know how many, over 100 chapters that come from every state, RNs, LPNs, nurses, doctors of our kind. It's so exciting.
Oh my God, I'm so excited. And Keita, tell us, because not too long ago, 2 years ago, we had the actual national conference here in St. Louis. So tell us a little bit about what happened there, because we sponsored it and it was our first conference. So we were really intimidated because this was the first conference that we were throwing and we were all new to our roles in the BNA. So tell us, how did that go? Because it turned out wonderful.
Well, we got a lot of good feedback from our St. Louis chapter conference. We were, yes, a little apprehensive and intimidated, as you said. We had people show up from across the country here in St. Louis, and we were like, "Oh my goodness, can we meet this thing? Can we meet the bar? Because a lot of the other states, like we had just came from Vegas, and they had the next one was going to be in Louisiana and New Orleans. It's like, okay, well, what are we going to look like here in St. Louis? But it turned out to be excellent. During our conference, we partnered with Homer G. Phillips and invited some of their alumni chapter members. We all dressed in white from back in the day. We were taking pictures together, and we truly represented where we started and where the path was burnt for nurses here in St. Louis and just all over the country, actually. So we were super excited about it, and it honestly, through feedback, it turned out to be an excellent time, and we will never, ever, ever forget it. Never.
Yes,
as the treasurer,
great.
I just want to put a plug in real quick that we also raised or had some of the highest financial benefits after we had conference than some of our larger national organizations as well. So we were very, very proud to not only just host, but be able to provide financial support locally and nationally from the benefits of our conference that year. So we did a great job. We really did. So we're proud of it.
And I got to shout out some of our big sponsors, BJC, SSM, and please chug in so I don't forget anybody, St. Louis Community College, who else? UMSL, SLU. A lot of our community partners showed up and showed out and helped support us with conference and also with our scholarship luncheon. So definitely you don't want to lose out. So if you are a community partner, please reach out to us, reach out to Dawn Patrick, reach out to our secretary, Michelle Randall, if you want to support the BNA of Greater St. Louis, because we are out here, we are doing wonderful things. We're helping in the community and trying to make sure that we address the needs of our population. So we can talk all night about everything that we do in the BNA, but I'm gonna kind of wrap this on up here. So Michelle, tell us for those members and Mia, because you are the membership chair for the BNA of Greater St. Louis membership chair, tell us about how people can join us, and if they really want to be a part of our organization, how do they get involved? How much does it cost? Because coins is kind of limited here right now, so we need to know how much we're going to be paying and what's the benefits of joining our organization.
Well, to join our organization, we can actually put in an application online through our local chapter, but we're trying to get everyone to be a national member as well. We want them to also come to our meetings. Right now, they're virtual, so they can see what our mission, our passion is, and they can learn a little bit more about us. And because we want them not only just to be a member on paper, we want them to be active in the community, to volunteer, to do out there and show what we are about. We also want them to join our committees, um, and also see the benefits, the opportunities, the sisterhood,
And
all
brotherhood.
and brotherhood, yes. And also we want to also, we're uplifting our nursing students, people that are changing careers, retired nurses coming back out. We want to reach everyone. The cost this year for RNs, there's $210. For LPNs, it's $175. Retired nurses are $150, and for students, it's $60.
Right. And Mia, and where can they fill out the application, and how do they pay if they want to get started?
So you can either fill out the application at www.nbna.org, or you can go to our website, www.BNA-STLewis.org. You can send us a message and we'll shoot you an email back if that you prefer that way. But we will be posting information on about our meetings on our social media. Our meetings are every fourth Saturday, so we have one coming up pretty soon. There's always kind of one coming up, and so we want
Yeah,
you
let me
to
get the
just
date for you. It is March the 27th from 11 to 1. So check our social media page, because we'll put the link there for you to join us on Zoom.
Mhm. And then the fourth Saturday after that, there'll be one as well. So that they're always there, and because we're active in the community. And so we use these meetings to kind of just touch base. And we want to make sure that we're supporting you all. We all are here volunteering our time and efforts because we really feel like that we need to do this for our community. And the only way we can really help our community is to help each of you.
Right, absolutely. You know, joining a organization like this is really getting involved with something that's bigger than yourself. You know, I know a lot of us, we work very hard. We go to work every single day, and we probably wonder to ourselves, how do we have time to be a part of the organization? It really don't take much. An hour here, an hour there, whatever you can do. It doesn't have to take up, 8 hours out of your week. You know, it's just whenever events come up, you know, we all kick in, we volunteer. Somebody might do 1 hour, another person might do another hour, and we just, do what we need to do. So it's really about networking, scholarship, continuing education, and really just investing in yourself. That is really the biggest thing about joining the BNA of Greater St. Louis. Is really a way to invest in yourself, because you're going to get so many positive things out of the fellowship with your other members, and what we do in the community. So I'll turn it over to our executive board. Any closing remarks before we end our first podcast with the President's Podcast? Any closing remarks, anything you guys want to make sure we cover?
Join us, we need you. We love to have you.
We are a family. That's what I want to add. When you come into the arms of the BNA of Greater St. Louis, you will come into a family. We love on each other. We're not just an organization that just sees each other once a month. We honestly keep up with you during throughout the month. And if anything is going on with you, if you need anything, we have an open door policy. Just reach out. So that's why our organization is worth joining, because we definitely are family.
Absolutely, absolutely. Well, thank you all for joining us, the executive board. I appreciate you. We doing the work. I know how hard you guys work, so I'm super excited that you were able to join tonight for our first session of the President's Podcast. So thank you for tuning in. Be sure to check us out every second Tuesday of the month at 7 p.m. We're going to be posting these live on Facebook. Sometimes we may do live, sometimes it may be pre-recorded, but check us out on Facebook Live, Instagram Instagram, Anchor, Spotify, wherever you get your podcast. Check us out. Be sure to like our Facebook and IG pages and subscribe to our YouTube page. And come check out our BNA YouTube page. We're going to be posting videos with continuing education, things you want to hear about in the community. And just join us, because we out here, we doing it. You're going to feel so much good about yourself and what you're doing for your community. So thanks again, and tune in next time, because we are the pulse to all things nursing in the loop. In the loop, right? Go ahead, Madam VP. Yes, all things nursing in the loop. So tune in. Thank you for joining, and have a great night.